Which of the following condition does not have a risk of cervical deformity greater than the general population? A. Neurofibromatosis. B. Larsen syndrome. C. Diastrophic dysplasia. D. Achondroplasia. E. Down syndrome. And the answer is D. Achondroplasia. Agree, everyone? Now let's get to know about its condition and its relationship regarding the cervical deformity. Neurofibromatosis and cervical deformity. Severe cervical kyphosis in the setting of NF1 neurofibromatosis type 1 is a rare manifestation of the disease in the pediatric population. Dystrophic and immature bone complicate the placement of hardware necessary for surgical correction of alignment. Neurofibromatosis patient presented within second decades of life, whereby the symptoms include neurological deficit, a neck mass, osteolysis of vertebral bodies with kyphosis of more than 90 degrees. It is among the common radiological features. Larsen syndrome and cervical deformity. It is a rare genetic disorder. It can be inherited as either both autosomal dominant or recessive. Patient manifests with either A. Atlantoaxial instability, subaxial cervical kyphosis, in poor neuric grade with or without any history of trivial trauma. B. Asymptomatic in terms of compressive myelopathy with C. Facial dysmorphism, a dish face, and D. forelimb deformity. The triad of odontoid hypoplasia, small bullet-shaped vertebral bodies, and typical faces of dish face is diagnostic of Larsen syndrome. Other comorbidities include osteochondrodysplasia, multiple joint dislocation, and craniofacial anomalies. Progressive cervical kyphosis and craniovertebral junction instability are two most crucial underlying etiologies for spastic quadriparesis. The natural cause of the disease is unpredictable. Next, regarding dystrophic dysplasia and cervical deformity. Dystrophic dysplasia, previously defined as atypical achondroplasia, is a rare genetic condition. It results from mutation localized at the distal long arm of chromosome 5. Diagnosis is possible before birth using a sonograms and DNA testing. Clinical features include short stature with short limbs, hip joint dislocation, unstable knee joint, and club feet. The thumb usually is wide, hypermobile with radial deviation, referred to as hitchhiker thumb. The nasal bridge is narrow with broad nostrils and cleft palate. Scoliosis constitutes the most common spinal deformity together with altered sagittal balance. Cervical kyphosis is less common but may cause severe neurological complications. This picture illustrates the hand of the newborn with dystrophic dysplasia showing brachydactyly, short fingers, and hitchhiker thumb. Okay, everyone. Our answer for this question is achondroplasia and cervical deformity. Nope, there is no association. The reason for our earlier answer is achondroplasia is associated with frequent stenosis of the foramen magnum in infancy as well as lower cervical stenosis. However, it is not associated with an actual deformity of the cervical spine. Lastly, regarding the Down syndrome and cervical deformity, atlantoaxial instability (AAI) affects 10 to 20% of individuals with Down syndrome. Atlantoaxial instability denotes increased mobility of C2 in relation to C1. The condition is mostly asymptomatic and diagnosed on lateral radiograph by the presence of an abnormally large anterior atlanto-odontoid distance (AAOD). The upper limit of a normal AAOD anterior atlanto-odontoid distance is 4 mm in patients who are younger than 15 years and 3 mm in older patients. The anterior space between the atlas and the axis normally opens in flexion and closes in extension, which is why the AAOD anterior atlanto-odontoid distance is greater when the neck is radiographed in flexion than it is neutral or extension position. This figure shows the drawing of a normal atlantoaxial joint showing the base of the skull, the upper 3 cervical vertebrae, and the measurement of AAOD, anterior atlanto-odontoid distance, and PAOD, posterior atlanto-odontoid distance. The danger of AAI, atlantoaxial instability, is that it becomes symptomatic in 1 to 2% of individuals with Down syndrome when the displaced odontoid impedes the spinal cord. Thank you.